improve cancer care for kids and young adults. It was the primary goal of this gathering in Chapel Hill, bringing together medical professionals from all across the country.
One of the big questions they're addressing is why cancer rates among young people are on the rise. Akila Davis was there for today's discussions.
Medical experts call the number of cancer cases in young adults alarming. They say it could happen to anyone at any age, and that's something even they have to accept.
It was incredibly difficult to find a doctor that would take me seriously.
At just 34 years old, Christine Bresky is a cancer survivor. The first diagnosis of non-Hodgkin's lymphoma came at 26. The second, synovial sarcoma, came at 30. Both times, doctors assumed she was overreacting.
Being a young adult with cancer, describing your issues, the typical phrase that I would get is, "Oh, but you're so young and healthy." The likelihood of that happening is so low.
Christine is one of the speakers here at the 7th Annual Adolescent and Young Adult Oncology Symposium, raising awareness on cancer in young people in a room full of oncologists, psychologists, social workers, and other leading medical professionals across the nation. Dr. Karen Wingfield is here from the Vanderbilt Ingram Cancer Center in Nashville, Tennessee.
We as providers, as clinicians, as healthcare centers need to be thinking about the different populations that we serve, all of them, and making sure that we're trying to ensure that every single person, regardless of their background, has access to world-class cancer care, right? And can survive cancer and survive it well.
The American Cancer Society says about 80,000 young adults ages 20 to 39 are diagnosed with cancer every year in the United States. Young women are more likely to be diagnosed with cancer than young men, but young men and women are equally likely to die of cancer. About 9,000 young adults die from cancer every year.
We don't totally know why, is the honest answer. Some of it may be lifestyle factors, red meat, obesity, alcohol use.
Cancer screenings, early diagnosis, treatment, and how to support young survivors were topics of panels, breakout groups, and discussions. Experts here today learning that early onset breast cancer and colorectal cancer cases continue to increase.
It's certainly worrisome, and that's something that is driving a lot of research in the area, programs dedicated to understanding why.
They recommend relentless advocacy. They say if something is wrong, don't be afraid to seek out a second opinion if you aren't getting the answers you need from your primary care doctor.
We might be young and we might look healthy, but unfortunately that's not always the case.
At UNC Chapel Hill, Akila Davis, ABC 11 Eyewitness News.